Salvin Dental offers implant, surgical, and perio-sterile packs in a number of options and configurations. Supplemental add-on packs are available to suit the specific needs and preferences of your practice. Consult your Salvin catalog or call for details and complete product support. Here is Dr. Walter Chidwood.
Aseptic Technique is relatively easy to implement in a dental office if you follow the basic guidelines. This video will show how the Salvin modular sterile pack system can be used to easily and effectively implement this technique and to help comply with OSHA regulations in your practice. Postoperative infections have been shown to be one of the leading sources of short-term implant failure. Several studies have shown that by implementing a strict aseptic technique, virtually all short-term postoperative bone infections can be eliminated. All implant manufacturers advocate aseptic technique for this very reason. We will be demonstrating the procedure using a non-sterile dental assistant, whom we'll call a circulator, a sterile assistant, and the surgeon. We'll first look at the room, staff, and patient preparation, then go over some basic guidelines. All countertops should be cleared of any unused equipment or objects that could potentially collect dust. The next step is to wipe down the entire room. All overhanging light rails, periapical x-ray machines, as well as the countertops should be wiped down with a hospital-grade surface disinfectant. Where practical, the walls should be wiped from 48 inches down. Don't forget to wipe off the fronts of cabinets and the operatory chair. The room should be wiped down prior to each implant surgery. Shoe covers, bouffant caps, and masks should be worn in the operatory. The non-sterile assistant opens the Salvin Standard Sterile Pack, which consists of 2 inner wraps, one for the doctor assistant components and one for the patient room setup components. It is best to open the component wraps in separate areas. The packs are OR wrapped so that the non-sterile assistant or circulator can open them without contaminating the inner contents. Open the inner wrap by pulling the folded tabs away from the center. Donning a pair of sterile gloves, we now arrange the components of the pack to make it easy to set up the room. The doctor assistant component wrap contains 2 hand towels and 2 OR gowns. Mask and bouffant caps are provided for your convenience. The patient room setup component wrapper is oversized and unfolds to serve as a back table cover. This inner wrap contains a bouffant cap for the patient, 2x2s, 4x4s, cotton tip applicators, suction, and aspirator tips, tubing covers, light handle and/or chair button covers, utility drapes with tape, a headrest cover, a suture bag, an OR towel, a multi-purpose machine cover, a Mayo stand cover, and a patient drape. All of these items are sterile and ready for use. While you may already have some of these items in your practice, including them in our sterile surgical pack makes for faster, easier room setup with an easy-to-implement, documented protocol. Remove the protective tape from the suture and saturated gauze bag. Then stick the bag to a convenient surface. Take care to not touch a non-sterile surface with your sterile gloved hand. At the conclusion of the procedure, you will use this bag to dispose of contaminated materials. At this point, you would add to the sterile field additional items to be used in the surgical procedure but not found in the Salvin pack. Examples of these are scalpel blades, sutures, bowls, and syringes. If 2 people are adding these items to the field, the non-sterile person opens the outer packaging, allowing the sterile person to take the item and place it in the field. If 1 person is adding these items to the field, She first opens the outer packaging of all additional items and then dumps them into the sterile field. This should be done just after the inner wrap has been opened, but before she dons her sterile gloves. Next, we cover the mayo stand. Place your gloved hand under the cuff of the mayo stand cover, exposing the opening. Start it over the tray of the mayo stand and continue to slide the cover over the stand. Practices that do not use a mayo stand will use this as a back table cover. The next step is to install tubing covers on your tubings and motor hoses. To install these without contaminating the sterile field, hold the tubing cover in your hand to keep it from dropping on the floor. If it is easier for you, you may unfold the cover out into the sterile field. Then slide the cuffed open end of the cover over the tip of the hose. Continue to slide the cover over the tubing, keeping your hands in the sterile area above the cuff. Take care not to let your gloved hand touch any part of the non-sterile area. These covers are designed for easy insertion and have a tape strip and a rubber band to ensure a snug fit around the handpiece or suction hose. Our basic packs include a multi-purpose machine cover. Make a cuff in the material and pull the cover over the unit. This cover may be used to cover any instrument that you desire. Now drape the light handle cover over the light handle, pulling the cover around so that the plastic sticks to itself. Our light handle covers can also be used to cover other items such as chair control buttons. Be sure not to touch the light handle with your sterile gloved hand. The utility drapes are used to cover bracket tables and other surface areas. To use them, simply remove the paper backing from the adhesive along the edge of the drape and use them in however manner you wish. The operating room towel can be used for an instrument mat, a head drape, a patient eye cover, or anywhere an absorbent drape is required. We now proceed to the scrub sink for gowning and gloving, both the sterile assistant and surgeon scrub. Now is the time to don your headlamp if you use one. Using a hand scrub brush, proceed with a 3-minute surgical scrub, starting at the nails and continuing down the entire front and back of the hands. Be sure to scrub down to the elbow without going back to keep from reintroducing bacteria to previously scrubbed areas. Rinse thoroughly from fingertip to elbow to allow residual bacteria to be washed away. Repeat your 3-minute scrub, concentrating on your fingernails, and rinse again. Pick up the white absorbent towel by one corner and shake it out to its full length, being careful not to touch any non-sterile surfaces. Use one end of your towel to dry one hand and arm. Then use the other end of the towel for your other hand and arm. The proper technique is to dry from fingers down to the elbow to keep residual bacteria from traveling back to your fingertips. Discard the towel when you are finished. With hands thoroughly scrubbed and disinfected, it is time to gown and glove. We will demonstrate the preferred close technique for gowning and gloving. Our sterile assistant picks up the gown by the shoulders, steps away from the counter, and shakes it to its full length. Unlike a bathrobe, the gown is entered from the back. The hands go into the sleeves, but do not extend yet through the cuffs. Our circulator now attaches the Velcro collar and ties the inside tie of the gown. Our operating room gowns have the comfort and feel of cotton, but are much cooler to wear. At this point, gloves are done using the close technique. Remember that your gown and gloves are sterile while your hands are just disinfected. To do this properly, pick up a glove by its cuff using the sleeve of your sterile gown. Place the cuff of the glove over the cuff of the gown and extend your hand into the glove. With your gloved hand, now pick up your other glove and repeat the procedure. Be careful not to tear the glove. Once the gloves are on, we use a simple grab, turn, and tie technique to finish tying the gown. Our operating room gown uses a passing card system to enable our non-sterile assistant to help. Hold the card in your right hand. With your left hand, pull the tie from the left side of the card to free it. Continue to hold the left tie as you hand the end of the card to the non-sterile assistant. Now twirl around, pull the tie away from the card, and complete the gowning procedure by securely tying the ends to reduce the blousing of your gown. Some practices choose the open technique for gowning and gloving the surgeon. Our sterile assistant holds the gown open for the surgeon, who dons it, extending his hands through the cuffs. The non-sterile assistant fastens the gown in the back. With this technique, the sterile assistant holds the gloves open for the surgeon, who plunges his hands into them. She then pulls the cuffs of the gloves over the cuffs of the gown. The procedure is completed using our grab, turn, and tie technique. Patient preparation is fast and easy with the salve and pack system. The first order of business in properly preparing your patient is to cover their head with the bouffant cap provided in our pack. This will help prevent contamination of the sterile field with hair and shedding epidermis. Next, connect your blood pressure cuff and other leads from your vital signs monitor. Some practices lightly restrict the patient's hands using hand restraints or ACE bandages. Salve and Dental Specialties provides a full line of Criticare vital sign monitors. Now is the time to place a nasal cannula if you use one. Scrub the operative site with an antiseptic solution such as Physohex, Paradex, or Betadine. Thoroughly brush the teeth, gums, inside the cheek, palate, and dorsum of the tongue. Next, prepare the lip and cheek areas. Using an antiseptic swab, start with the lips and paint in increasing larger circles. Work your way to the chin and up to the nose. Be careful not to go back over scrub areas to avoid reintroducing bacteria. At this point, we are ready for the final patient draping. The Salvin modular pack system offers a choice of two types of patient drapes to suit the needs and preferences of your practice. Choose our pack with a fenestrated or round opening drape if you prefer to keep your patient's eyes covered. Choose our pack with a split sheet patient drape if you prefer to keep your patient's eyes uncovered. Our fenestrated or round opening drape exposes the patient's mouth and nose. To use this drape, hold the drape in your gloved hand. Peel off the backing to expose the adhesive surface which surrounds the operative opening. Place this drape on the patient using the directional labels to properly orient the drape towards the head and feet. The drape is placed first, then unfolded. Our split sheet drape divides at the chin to expose the patient's full face. It is usually used in conjunction with a head drape. Using the directional label to align the drape properly towards the head and feet, place the drape on the patient's chest. Open first to the sides and then to the foot. Pull the split end of the drape back onto the chest to give yourself a sterile working area. Remove the protective paper to reveal the adhesive strip. Bring the split up to the chin and the sides of the face. To complete the draping of our split sheet version, we use a head drape. Unfold the head drape in your sterile field. Remove the protective paper. Place the drape across the patient's forehead, leaving the eyes exposed. Both drapes have a foam surface, which acts as a cushion and as a non-slip instrument pad. This completes the draping of the patient, and surgery is ready to begin. Let's go over a few basic guidelines to follow during the surgery. Guideline number 1. All items to be used in the procedure must be sterile. We must take special care to ensure that we do not contaminate the sterile field with the additional inclusion of non-sterile items. Remember that off-the-shelf sterile items such as implants, sutures, scalpel blades, and the implant pack itself are sterile only within their inner wrappers. Remember to check expiration dates where applicable. Guideline number 2. The surgical team must be gowned and gloved. Hand movement must be made within the sterile zone. Once properly gowned, the zone considered sterile for the surgical procedure is defined as the front gown area from mid-chest to waist level. The arms and sleeves are considered sterile from the gloved fingertips to 6 inches above the elbow. Be sure to keep your hands and arms within the sterile zone to avoid contamination. Guideline number 3. Movement within the operating field must be very limited to avoid contaminating the sterile field. Surgical team members should face the sterile field. If a sterile person must pass a non-sterile person, they should do so back to back. Guideline number 4. Sterile objects must not be touched with non-sterile objects. This is important when adding items or pouring liquids into the sterile field. When pouring a liquid such as sterile saline into a cup on the operating tray, the sterile assistant moves the cup to the edge of the tray. The circulator then pours the liquid into the cup, taking care not to touch the cup or anything on the tray. Instruments are also introduced into the sterile field without contaminating it. So what's the big deal about implementing aseptic technique for implant surgeries? We want to reduce the amount of postoperative infection and implant surface contamination, two of the major factors in short-term implant loss. The Salvin modular pack system makes implementing an aseptic technique easy and efficient.
This program has been presented by the Continuing Education Department of Salvin Dental Specialties Incorporated. For more information, please refer to the current Salvin catalog or call us at 800-535-6566.
We look forward to hearing from you soon. Call us when you're ready and we'll take great care of you.